Thank you. Minister, you might have seen I was wearing my 24/7 cardiac care mask for Waterford. I'm sure you haven't forgot about that campaign. First of all, can I welcome you and welcome your team? And I have a lot of questions to get through. I have 10 minutes, so as an experienced politician, I'm sure you'll know I need distinct answers to the questions if that's possible. Minister, I know we're dealing with very complex issues as well. My first question and the first topic I want to deal with is the preparedness for the coming number of weeks and months in our acute hospitals. And obviously we're dealing now with COVID care, non-COVID care, missed care, the need for catch-up care and so on. So the first question I have is, what is the anticipated shortfall in acute bed capacity arising from hospitals not exceeding the 80% capacity to ensure that we have surge capacity, and also because of infection control and social distancing measures? So how many beds is it anticipated that there may be a shortfall in because of those measures? If you have that figure, please.
Thank you, Deputy Cullinane. Can I give you the critical care capacity first? Because I think in terms of surge capacity for COVID-19, that's a figure that the HSE and the clinicians are focusing on very, very strongly. So as we know, the critical care bed capacity in our system before COVID arrived was 255 beds. That's 204 beds, ICU beds, intensive care beds, and an additional 51 HTU beds, or high dependency unit beds. At the height of the surge, the capacity for critical care beds was approximately 500. As of this morning, the total capacity in critical care beds is 302 beds.
Can I just stop you there, Minister, and welcome that? And we need as many critical care beds as we can get. But I do want to bring you back to the number of acute hospital beds and the advice that you've been given in terms of what is the anticipated shortfall or the anticipated lack of capacity, bed capacity, acute beds, because of the 80% rule of not exceeding 80% capacity and social distancing guidelines. What figure have you been given?
So, Deputy Cullinane, the winter plan is the process by which the HSE is doing the...
I know that. I've asked you for a figure, Minister.
Yeah, the winter plan is the process by which the HSE is doing the detailed modelling on that. The reason...
do you have a figure today?
The reason, Deputy, there isn't a figure today is because we are learning very, very quickly about this. So, for example, in your question, when you and I learnt about this first, the figure we were both given was that the hospitals couldn't operate at more than 80%. That was based on a variety of advice from the HPSC, including, for example, 2-metre distancing. Over the last number of weeks and through the next few weeks, which is why we don't have a figure yet, an awful lot of detailed work is going on.
Minister, can I bring it? Did you read your own ministerial brief?
Yes, Deputy, I did.
See the figure that was in the ministerial brief? Do you know what that figure is?
Deputy, what I'm saying to you
I'm asking, please, Minister, I'm asking a very straight question because this is a very serious issue. Did you read your ministerial brief? And if you did, can you give me the figure that they say will be the potential of lost capacity in your own brief that you were given in terms of for all of those reasons?
The HSE is approximately 11,000 beds, and 20% of that would be approximately 2,200. But, Deputy, what I'm
That's not what they say. So I'll read it for you, Minister.
What I'm telling you, Deputy,
I'll read it for you, so at least we're clear on what the figure is.
The 80% figure is an old figure that doesn't apply. So, for example, occupancy in the acute system right now is approximately 96%.
Okay, so what your ministerial brief says, Minister, and we can only go on the information that we're being given by your department. It says, and I'll quote, the HSE is estimating a 20% decrease in targeted inpatient cases for 2020. It has also estimated that there could be a shortfall in capacity due to safe distancing requirements and reducing utilisation to 80% of 4,700 beds based on a current baseline of 11,000. 4,700 beds. Now, I put in a parliamentary question looking for a breakdown on a hospital-by-hospital basis, and the response that I got back was that the department, it says, that I regret that the information is not collected in the form that you require and is therefore not available as requested. So if we can't even get a breakdown of what that will mean in each hospital or each hospital group, and we're trying to plan as well and to support government in terms of what solutions are in place, whatever the figure is, I think we can agree we're going to lose capacity. And what people want to know, and what frontline healthcare workers want to know, is how we're going to replace that capacity. So if the figure is as bad as they say it is, and it is 4,700 beds, how is that shortfall in capacity going to be made up, and where is the plan to make up that capacity?
So, Deputy, what you read out was that the HSE has 11,000 beds, and we need to move from about 100% occupancy, which is unfortunately where we were at, to about 80% occupancy. That would require 2,200 additional beds. What I'm saying to you is, thanks to an awful lot of good work in every hospital and by central HSE working with the HPSE, the additional number of required beds has reduced from that very high figure, and they don't yet have a final figure. That figure is being produced, Deputy, with the winter plan. Now, as you
whatever the figure might be, Minister, my question now is, because we can only work on the figures we're given, my question now is, there is going to be lost capacity, so how are we going to replace it? What are the options that are on the table here? When we know every single winter there is a crisis in our acute hospitals, every time. And if you're dealing now with COVID, non-COVID care, catch-up care and reduced capacity, we have a perfect storm coming at us, and we need more beds and more staff in the system. So in terms of beds first, how are you going to inject more beds into the system?
Well, can I say thank you, Deputy, and can I say the challenge is wider, obviously, because it's not just acute beds, it's primary care, community care, inpatients, outpatients. This is exactly what the winter plan is looking to do. It is being produced several months early. It will be the most comprehensive winter plan that has ever been launched. And because of the costings involved, as I'm sure you'll appreciate, it's not going to be cheap. It will require discussion.
I produced my own plan, Minister, by the way, and I did send it on a copy to your office. But the question I asked was, and I appreciate there needs to be a winter plan. With respect, Minister, the question I'm asking is, what are the options in terms of increasing bed capacity? Yes, we need more investment in primary care. Yes, there's more supports for people with disabilities. Yes, we need to do more in nursing homes, but I'm specifically dealing with acute hospital beds with respect. And I'm asking, you can't give me the figure as to exactly how many beds will be lost, but surely you have an idea about how you're going to replace that capacity.
I do, Deputy. So let me tell you some of the things that are happening already. So already home care packages have been increased by 2.6 million hours. These are all COVID measures. Community assessment hubs have been introduced. There's 29 teams. The number of acute hospital beds that's been increased this year is 400 in order to deal with the additional capacity, and I'm seeking funding to maintain that all 400 of those beds stay open. We have additional critical care capacity of 42 beds. 1,600 nursing staff have been upskilled to support critical care. There's been an increase in the number of intermediate care beds. We have 700 open, and I'm seeking that they would all stay open. As you know, there's been enhanced infection prevention and control, PPE, cleaning and disinfectant. There's also, Deputy, as I'm sure you'll appreciate, part of your very reasonable question is, how do we increase bed capacity? The other part of it is, how do we keep as many people as possible out of the hospitals? The clinical hubs are working very well. We're looking for them to continue. The mental health support desk has been working very well. We're looking for that to continue. And obviously we're upgrading a lot of other supports around that at the same time. So supports for GPs, new GP contracts, safe staffing levels for nursing, and many more complementary measures as well.
Well, Minister, can I say to you, in the ministerial brief, it also says that even if we were to take all of the capacity in the private system, every single bed, it still wouldn't be enough to make up the shortfall. So I think there's an urgent need to bring this plan forward. And two final questions I have for you. The Be On Call for Ireland, and the latest figures I got at the end of July was that there was 1,639 frontline staff available to come into the system, 260 nurses, 341 doctors, 228 healthcare assistants. How many of them since the end of July have actually been offered work? People will find it extraordinary that we have 1,600 frontline workers that could be brought into the system, and we're also being told that there are some beds that are not operational because we don't have the staff. And people are just amazed as to how we can have nurses and doctors and healthcare assistants available in what's called a pool to come in, and they're not there. And my final question, if you get a chance to answer this as well, is that you will know that there is a high-profile campaign by cancer patients and by others for medical cards for patients who are terminally ill. I think there was a report that's due on your desk in the next number of weeks. Can you give us an indication when that will arrive? And is this something that you still support? And is this something that we may well see in the budget coming up this year as well? Thank you.
So, Minister, could I ask that you answer the first question, how many have been employed, and provide a written answer, maybe, because it should be a short answer, how many have been employed, and provide a written answer to the rest to Deputy Cullinane.
Can I say, Chair, first on the winter plan, can I agree wholeheartedly with Deputy Cullinane? The challenge that we are facing cannot be underestimated, and as the Deputy has pointed out, there is a very real reduction in capacity in the public system, and I look forward to engaging with the Deputy and the Oireachtas on that winter plan. Deputy, I'll send you a detailed briefing in terms of the frontline workers, but my priority on nurses is that we reach the safe staffing levels that were agreed last year. The nurses and midwives went on strike. Deputy Cullinane, you and I joined them on the ballot for that strike. A Labour Court recommendation was agreed.
Thank you.
Progress hasn't been made. My priority when it comes to nursing and midwifery staff is that agreement is honoured and we reach these safe staffing levels much quicker than has been happening to date.
Yes, Minister. Just on the question, it was a very specific question.
How many of them have been given a contract?
Ireland on-call people who came back from Australia, wherever, how many have been employed? Because it's something that
I'll get the committee a detailed briefing on that, Chair.
maybe today is Wednesday. By the end of this week,
I'm sure no problem at all. Yep.
The next